And one of the reasons that I keep talking about hydroxychloroquine is that the question that nobody ever asks, and the question that I most hate the answer to, is what happens if you do have a ventilator? What are your chances? And I just hope that hydroxychloroquine wins, coupled with perhaps the Z-Pack, as we call it, dependent totally on your doctors and the doctors there. Because you know the answer to that question. If you do have the ventilator, you know the answer to that question. And I hate giving the answer. So I don't want to get them there. I don't want to get them there. There's a possibility. And I say it. What do you have to lose? I'll say it again. What do you have to lose? Take it. I really think they should take it. But it's their choice. And it's their doctor's choice or the doctors in the hospital. But hydroxychloroquine, try it if you'd like. The other thing, if you have a heart condition, I understand, probably you stay away from the Z-Pack. But that's an antibiotic. It can clean out the lungs. The lungs are a point of attack for this horrible virus. But when you have a ventilator, don't ask the answer because I hate it. If you have it and it's working beautifully, I don't like the answer because it's not a very high percentage. So I want to keep them out of ventilators. I want to keep them, if this drug works, it will be not a game changer because that's not a nice enough term. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works. Because when people go into those ventilators, you know the answers, I know the answers, and I'm glad you don't write about it. Mike, please.
Well, you've heard from the experts what our task force has heard. That it's going to be a difficult week for the American people. You will see testing increased around the country, and so cases are going to continue to rise across America. And before I give a few facts relevant to an earlier question about ventilators, let me add my voice to what the President just said and what all the physicians who've spoken have said. Even though we see the losses rising in the days ahead, do not be discouraged, because there is evidence across the country that Americans have been putting the social distancing and mitigation into practice, and it is making a difference. We are seeing it in the new cases that are being reported. Because remember, families that experience loss up to this day and in the next week have a loved one who contracted the coronavirus, in most cases more than 2 weeks ago. In many cases before social distancing and mitigation efforts were put into effect. And so we want to encourage you, believe in the President's coronavirus guidelines for America. Go to coronavirus.gov, print them off again, put them on the refrigerator, and remind yourself to put them into practice. On the subject of ventilators, if I can amplify the point the President made, our team at FEMA is doing a remarkable job working with governors, state health officials, and local hospitals, particularly focused on our priority areas. We'll refer to the New York metro area, which includes New Jersey and Connecticut. We're focused on the New Orleans metro area in Louisiana. We're focusing on Detroit. We're focusing on Chicago. These are the areas where we see the significant rise in cases. And we are surging supplies, specifically ventilators, but all personal protective equipment from FEMA to those areas. And just to give you a couple of examples, I spoke to governors in New York, New Jersey, Louisiana, Massachusetts, Michigan, and Maryland today alone. And in those cases, Governor Cuomo is actually assessing all of the available ventilators. We've sent 4,400 ventilators already to New York. As has already been referenced, they're going to receive a shipment of over 1,000 from overseas. And allow me to say, as I told her personally today, the governor of Oregon, Governor Kate Brown, her unilateral decision to send 140 ventilators because Oregon, they felt Oregon today is in a place where they could give those ventilators to New York, to me was in the very highest American tradition of loving your neighbor. And when I talked to Governor Cuomo, Mr. President, he actually told me they never asked Oregon for the ventilators. And Governor Brown hadn't even called him to tell him that she was doing that. It really is remarkable. When I talked to Governor Hogan today, and the President and I will be speaking to all of America's governors on Monday again, I told him how inspired I was and how he ought to spread the word to other governors in areas where they can spare resources to be joining with us at the federal level and providing them to states at the point of the need. But just a few for instances. As we track New Jersey, as I told Governor Phil Murphy, we deployed 200 ventilators to New Jersey today. Louisiana, where we're monitoring literally hour by hour what's taking place in New Orleans with some encouraging news, but still great challenges. Yesterday, you heard the President say that we deployed 330,000 gowns that have been delivered to the public health systems and hospitals there, 200 ventilators. I spoke to Governor Charlie Baker today and was able to inform him. We're watching Boston area very closely. 100 ventilators are deploying today. I spoke to Governor Gretchen Whitmer today. Detroit is experiencing a significant number of cases. We're watching it carefully. And today, FEMA directed 300 ventilators to Michigan. Again, as the President said, we're all working our hearts out. But what I want to say to American families and what I want to say to healthcare workers is that we are going to identify the resources, leave no stone unturned, and we are going to focus resources on those areas in the order that they emerge. Now, the last thought is back on mitigation. We are hoping that we do not see other major cities in the country experience what Seattle experienced, what greater New York City area is experiencing, what New Orleans is experiencing, and that's all in the hands of the American people today. So I just want to encourage you, coronavirus.gov, put into practice the President's coronavirus guidelines, and you will do your part to save lives, protect the American people, and ensure that we will have the resources to meet this moment wherever the need should arise.
Mr. President, you spoke earlier about the SBA loan program that got up and running yesterday, but we're hearing from a lot of small business owners,